This morning. Many digestive diseases have similar symptoms. It can be confusing, and most people don't like to talk about it. But having a gastrointestinal problem is pretty common, and there's no need to suffer in silence. Joining us this morning from Spectrum Health is gastroenterologist Dr. Andrew Shreiner. Hello, doctor. Good morning.
Good morning. Thanks for having me.
Glad you're here. So, what are the symptoms? I mean, the common GI, if we can shorten it up, GI issues that people have.
So as a gastroenterologist, we evaluate patients with a lot of different symptoms. So these can include difficulty swallowing, heartburn, reflux, nausea and vomiting, abdominal pain.
Sounds like fun.
Yeah, bloating, increased gas, getting more fun as we go along, diarrhea, and constipation.
I think you nailed all of the ones that are in that Pepto-Bismol jingle. I think they're all in that list, right?
Yeah,
so if you're having gastrointestinal issues, coming to see a specialist may be in your future. And with these symptoms, the common diseases, when you see someone and they have one of these symptoms or numerous, what are the most common diseases that you're finding?
Sure. So, sometimes we focus on treatment of certain diseases. Other times we focus on prevention of diseases.
Okay.
So if I can mention a few of the diseases we focus on preventing. So colon cancer, third leading cause of cancer in the United States. Screening for colon cancer is known to decrease the likelihood that one might die from colon cancer.
Okay.
Therefore, we recommend screening for everybody aged 50 to 75. Some people may be at increased risk for colon cancer, such as those with a positive family history, and so they may need to start screening even earlier. Hepatitis C is a chronic infection that can cause end-stage liver disease called cirrhosis and liver cancer. About 1% to 2% of the U.S. population is infected with hepatitis C, and about half of those people don't even know it. Thanks to some recent advances in treatment, most cases of hepatitis C can be cured, and so the CDC recommends that everybody born between 1945 and 1965, as well as anyone with any signs of liver disease, be screened for hepatitis C.
Well, if you're listening right now, then, and if that's your date range of your birthday, you want to pay attention and make sure that you get this screening, because as medical advances happen, it can really greatly affect your health. A lot of people, when they come with gastrointestinal issues, I mean, it can be kind of embarrassing. You're talking, there's some flatulence, there's some odor involved. We're talking about the part of the body that most people call the privates, because we like to keep them private, right? How can you encourage someone to make sure that they actually do talk to their doctor?
Yeah, so, gastrointestinal problems are kind of a universal human experience.
Sure.
So we all share these same processes. It's something that we evaluate and treat every day. So there's nothing any patients are going to tell us that we haven't heard before. There's doctors waiting to talk about these things with you. And as I mentioned in brief, there are a variety of diseases that may be suggested by different symptoms, and so being evaluated, being treated is very important.
And when you're talking about those who are dealing with these symptoms, let's say right now I'm suffering from, I've got some ridiculous bloating, or I just feel nauseous all the time, or this is something that might be something I want to look into. Do I go to my primary care physician, or should I go straight for a referral?
So either case is fine. You can certainly call our clinic and ask for an appointment, or you can talk to your primary care doctor, and they oftentimes facilitate referrals if needed.
Now, we're talking about the latest advances in medical care, and Spectrum Health obviously on the cutting edge. Talk about how it is to work for Spectrum and what you guys offer. I mean, it's really a team effort.
Sure. So I've been arrived at Spectrum a little over a year ago. I've been very excited to join Spectrum Health. We do have very comprehensive care plans for all of our patients. So it's been great excitement. For instance, we talk about inflammatory bowel diseases within the gastrointestinal group. These are inappropriate inflammatory conditions that cause tissue injuries throughout the GI tract. Very complicated conditions treated with medications typically to suppress the immune system. So we have specialty clinic to treat inflammatory bowel disease.
It's not a one-size-fits-all, is it?
No, that is absolutely true.
Yeah, and Spectrum Health, obviously, and Dr. Andrew here can help you through those problems. If you have questions or problems that you're suffering through right now, visit spectrumhealth.org/digestive health and learn more. That's spectrumhealth.org/digestive health. If you just want to contact Spectrum Health Gastroenterology or the IBD Clinic, call 616-267-7414. Thank you very much for the information, Doctor.
Yeah, thanks for having me on today.
Absolutely.